Well, in a new poll from health policy organization KFF, 3 in 5 adults say they will probably not or definitely not get a COVID-19 vaccine this fall. And while there are many reasons why people decide against vaccination, doctors say misinformation is one factor that could be playing a role. Our CBS News Confirmed team investigates some of the most persistent false claims about vaccines.
Nearly 5 years after the first COVID shots rolled out in the US, doctors say misinformation is still a top reason patients hesitate.
The reason it's bad out there is because people are rejecting a technology that can save their lives. And the reason they're rejecting that technology is because they're reading things online that are misleading them.
New polling from KFF shows more than half of adults turn to social media for health information, where false claims often spread. We asked Dr. Paul Offit to fact-check some of the common myths online. First, false claims frequently focus on ingredients. Now, there can be small amounts of ingredients like aluminum salts to make vaccines safer and more effective, but there's no evidence these tiny amounts are harmful.
If you look at the level of aluminum in someone's bloodstream or in their hair, you can't tell whether they've gotten aluminum-containing vaccines or not because you get a far greater quantity burden from living on this planet. So I think that's the problem. I think people have problems with anything with a chemical name.
The evidence from thousands of studies, including those conducted or reviewed by the Centers for Disease Control and Prevention and the Food and Drug Administration, show vaccines are safe, and serious adverse reactions to additives are extremely rare. Another common myth is that contracting the virus is better for you than getting the vaccine. Now, doctors say it's true that an infection provides some immunity, but it also comes with serious risks, which a vaccine can help prevent by avoiding the infection altogether.
The purpose of a vaccine is to induce the immunity that is often the consequence of natural infection without having to pay the price of natural infection, which can be high and life-ending.
Finally, you may have heard claims that getting the vaccine can actually give you the disease. According to the World Health Organization, though, vaccines work by training your immune system to recognize and fight off germs. They use only killed or weakened versions of a virus or bacteria, so they do not cause the disease or put you at risk of its complications. If you experience mild symptoms with some vaccines, it's actually a sign the vaccine is working.
For example, the measles vaccine can occasionally 10 to 14 days after inoculation cause a very short-lived mild rash. But that's not measles.
Doctors say vaccine efficacy depends on herd immunity, when enough people are protected to slow the spread of a disease. Experts say the best place to discuss concerns is with your doctor, and that vaccines remain the best defense against many serious illnesses.